Well, today we're going to ask and get answered the questions that you may have about visiting a dentist. I'd like to welcome from 7 Day Dental. We have Dr. Christine Chung and Dr. Chuck Lee. Good to see you again.
Good morning again.
Good morning.
Always great to have you here. We're going to go through some questions here that I think a lot of people have. And I think the first one is, how often do I actually need to visit a dentist? And does it go by age? Does it go by maybe some medical conditions you might have? How do you determine that?
Good morning. Well, the first question is, how old can you see a dentist?
Mm-hmm.
We recommend that kids, when they have teeth, you start bringing them to the dentist like 1 or 2 years old.
Okay.
First of all is to get acquaintance to the office,
Mm-hmm.
to the dentist, to the staff, to the environment. So as they get older, it's like a routine
Yeah,
to them.
that's a very
And they're
good
not-
point. I
They're
agree
not
with
scared,
that,
they're
yeah.
not being afraid when they, every time they hear the term dentist.
Yeah.
But generally, we recommend patients to go visit or a regular checkup to the dentist twice a year.
Mm-hmm.
However, for patients who has underlying periodontal disease or
Right.
gum disease, where your gum have bone loss, attachment
Mm-hmm.
loss, you would need more frequent dental care from the dental office. I would say every 3 or 4 months instead of 6 months. So 3 or 4 times a year.
Okay.
Yeah. Do you have anything to add on?
Well, I was going to add on, usually babies, their first teeth come in around 6 months.
Mm-hmm.
And although we're not going to do anything if the baby comes and visit us, but I think it's a good idea to have your baby boy or girl come in, and we just evaluate and make sure that the teeth are growing correctly. Our daughter was missing a tooth, so we were waiting.
A baby tooth?
Yeah.
Oh, yeah?
She had one that popped in, but the other one never popped in.
Yeah.
So it's always good to make sure that
yeah.
the teeth are growing correctly. Although we may not do anything, we would just look and see, and then the baby goes home. But sometimes we may have to take an X-ray, like in my daughter's case, to see if there is a baby tooth coming in.
Yeah, but you make a very good point, bringing a child in or bringing a baby in, because getting them used to doing that, it relieves any kind of anxiety they may have about going to the dentist or doctor. It really doesn't matter, but they get used to it. This is a routine that I'm going to start doing. Yeah.
Right.
You know, having practiced for many years, over 25 years, I've seen that kids or parents that go regularly to the dentist, or they train their kids to go to the dentist regularly, they usually don't have problems. They have less problems. They have less cavities. They have less gum problems.
Yeah, interesting.
And the people that usually have no cavity, that they never go to the dentist, and then they come in after 10 years, 5 years, and they usually have some type of gum disease.
Okay.
And it's usually very aggressive then, because you have to do a lot more, and I've seen that. So I think it's really good to get the kids to go regularly, and then as they grow older, they'll remember to go regularly.
Yeah, I agree.
Yeah, and I want to add another misconception is that, oh, I don't have insurance, and I feel like my teeth are fine. I don't need to go to the dentist. But I think I need to stress it's important that you do go see the dentist regularly. Sometimes you feel like you don't have pain, you don't have any sensitivity, but plaque only takes 24 hours to build up, and if you don't take care, you don't have optimal hygiene at home, it might get calcified or it gets hardened.
Right.
You cannot brush it out. So you have to go to the dentist, we do x-ray, we do checkup, and we have hygienists or dentists, they do cleaning for you, and that's regular maintenance of the gum. And it's just so important, even if you have to pay out of pocket because you don't have insurance, it's still important to go to the dental office regularly instead of saying that, oh, I don't have insurance and there's nothing wrong with me, so I'm going to skip this year or I'll see you next year.
All right. Now, the whiteness of teeth, people want nice looking teeth. They may have perfectly healthy teeth, but they're not the color that they want. They're not as bright as they want. tell me about the proper way if somebody wants whiter teeth. What is there the right way to do it? Are some of these kits you hear about, are they safe? And is it something that somebody can do regularly? Tell me about the best way to do that.
Yeah, that's a good question, because most of the time when the patient come in, their first question would be, I like to have my teeth whitened. I like to have a celebrity teeth. And so everybody wants white teeth.
Yeah.
So there are two types of stain or discoloration. One is called intrinsic or extrinsic, which is the stain that's outside. It can be polished off,
okay,
or it can be bleached, or the stain that it's internal, and that we would have to improve on doing by stripping off the enamel and do veneers and do crowns, and that's would be a more permanent restorations.
Okay.
Yeah. So anyway, when a patient comes in, our philosophy is always, let's try teeth whitening. Teeth whitening now works for all patients, from any kind of brown stain, yellow stain, or even gray stain. Now, the brown and gray stain is going to be harder to remove. However, if you whiten your teeth, it will remove, but it's just maybe not as much as you like it to remove.
Okay.
So, so that's the misconception. Some teeth don't whiten at all. No, that's not true. They do whiten. It's just not to the level we like.
Okay.
So there's three types. The first one is the in-office, where you sit there for an hour and it's a Zoom, and we have the light goes on, or you stay there. We put the gel on. We put the protective dam on the gum, and you relax for about an hour. That's one way. The second way is the take-home, where you get custom trays, or we have the 7-day dental one where you can wear it, and it's a vibrating light, and it's a zero sensitivity. You could do that, or you can go to the store and get the very inexpensive Crest White strips or something like that. The only thing is, the take over the counter is going to be very low dose, so it's not going to work as fast and as effective. So a lot of patients, they always like to try out that first, and if they see some results, then it's a good idea to go to the dental office and get a professionally done, where the dentist is monitoring the teeth whitening process.
All right, we got just a little bit of time left, and I want to get to a question I think a lot of people have. Why is it that I need x-rays when I go to the dentist, and do you need it every single time? Like, say you go every 6 months or something like that.
Well, dental x-ray, the exposure is very, very minimal. Some patient thinks that with x-ray, regular x-ray, they will get exposed to the radiation, but actually it's very, very small. And now that we have digital, digital in all our 4 offices, the radiation is insignificant.
Right.
And we recommend once a year, but for patients who have high prone risk of caries, then maybe every 6 months, because during the 6-month period, a dental cavity can develop. And we can catch right away when it's a small cavity. It's just a simple filling versus crowns or root canals.
Right.
Yeah, so it's very safe.
Yeah. Oh, yeah.
Well, for kids between up to 18, we recommend usually every 6 months. And adults at 18 and above, we recommend once a year.
Okay.
But I've seen where, as I've said before, adults now, after they hit 40 and above, we're on some type of medicine, high blood pressure, cholesterol. And in those kind of patients, you're going to develop more of a dry mouth. And it's where that's a side effect of taking medicine. And when you have dry mouth, you're going to get more accumulation of plaque around the teeth, around the gum and the teeth, and it's harder to brush and clean it. So at that point, I recommend maybe x-rays every 6 months for those patients to make sure that we're not developing any new cavities.
All right, that makes sense. I want to tell everyone that you folks, if you don't know, are located right over the Willow Tree Center, the ever-changing Willow Tree Center, the ongoing, which is good. Everybody's getting a nice refreshed look over there.
Yeah.
And online is 7daydental.com, and then you can click on where the location here in Laguna Woods. Thank you very much for coming on. And I love these questions that we talk about.
And you know what? Because
yeah.
of Mother's Day in May, we're
Yeah.
running a promotion for bleaching.
Oh,
it will
very
be
good.
50% off, and we might run to June for Father's Day.
Father's Day, you got to be equal, right? All right.
Yeah.
Good to
you so
see you.
much.
Thank you very much,
Thank you.
Christine.
Thank
Chuck,
you.
Good to see you. Take care. We'll be right back. Do you guys do?